Okay, we have all been there. You wake up one morning and bam, you just know you're sick. It hits you out of nowhere and can totally wreck your entire week, right? So in this explainer, we're going to break down exactly what's going on inside your body, and more importantly, how you can get back on your feet, fast and safe. Let's dive in.
Ugh, it is the worst feeling. You open your eyes and everything just feels wrong. Your head is pounding, your throat feels like sandpaper, and that one big question just starts looping in your brain. Is this something I can just sleep off, or do I actually need to see a doctor? Well, let's figure that out together.
All right, so what exactly are we talking about when this happens? Well, doctors have a name for this kind of thing, the sickness that comes on super fast. They call it an acute illness. And honestly, just understanding what that term means is a huge first step in knowing how to deal with it.
It sounds kind of technical, but it's actually super simple. Acute really just means it happens suddenly and it doesn't stick around for long. So, it's the total opposite of a chronic condition that can drag on for months or even years. An acute illness is more like a lightning strike. It hits you hard and fast. But here's the good news, it's usually gone almost as quickly as it came.
And I guarantee you've had one of these before. We're talking about all the classics, right? The common cold, the flu, that sudden awful earache, or, oh man, that nasty stomach flu. The kind of stuff that can just completely knock you out for a week. But the key thing to remember is they are almost always totally manageable, as long as you know the right steps to take.
Okay, let's get to the million-dollar question, because this is probably the most important part. You're at home, you're feeling absolutely miserable. When do you stop trying to tough it out and actually pick up the phone and call a doctor? Let's go through the red flags you absolutely should not ignore.
So, look, we're not talking about just a little case of the sniffles here. We're talking about the serious stuff. A fever that's sky high and just won't come down. Pain that's really severe, like in your throat or ears, or any kind of trouble breathing. That's a huge one. And maybe the most critical signal of all, if you've been doing all the right things at home, resting, drinking fluids, and you're actually getting worse instead of better, well, that's your body screaming at you that it's time to get some help. All right, so you made the right call and you've got an appointment. But what actually happens when you get there? If the thought of a doctor's visit makes you even a little bit nervous, this next part is totally for you. We're going to pull back the curtain and walk through the exact process so you know what to expect. Honestly, it's a really straightforward step-by-step thing. First up, your doctor's just going to talk with you. About your history, what your symptoms are like, and do a quick physical exam. From there, they might need to do some tests, maybe a swab or a blood test, just to be sure they know exactly what's going on. Then comes the plan. And yeah, that might mean a prescription for medication, but it's also about stuff you can do at home. Pain relief, hydration, and making sure there's a follow-up to see that you're getting better.
All right, time for a little rapid-fire Q&A, because let's be real, there are so many myths and questions out there when it comes to being sick. So we're going to take on a couple of the biggest ones and give you some clear, no-nonsense answers.
First up, the big one. This has got to be the #1 question doctors hear all the time. You feel terrible, you just want it to be over, and you think an antibiotic will fix this. It feels like it should be the magic bullet, right? But is it?
The answer is a huge, flashing neon no. And this is so important to get. Antibiotics are designed to fight bacteria. They do absolutely nothing against viruses like the common cold or the flu. Taking them when you don't need them doesn't help you, and it can cause bigger problems down the road. That's why seeing a doctor is so critical, so you can get the right medicine for the right bug.
Okay, next question. This is another one that's super important. It is so easy to think to yourself, it's just a little infection. I can power through this. I'll be fine. But could that tough it out attitude actually lead to something way worse?
100% yes. An untreated infection absolutely can become a long-term problem. Think about it. A seemingly simple UTI, if you ignore it, can turn into a really serious kidney infection. So getting care early isn't just about getting relief right now. It's about stopping a little problem in its tracks before it blows up into a major one.
Okay, so we've covered a lot, right? We talked about what an acute illness is, the red flags to watch for, what a doctor's visit is like. So what's the bottom line? What's the one big takeaway from all of this? Let's boil it all down.
It really boils down to this. Getting to a doctor quickly does 3 huge things for you. It helps you feel better faster, it stops small things from turning into big, scary complications, and it gets you back on your feet and back to your life sooner. It's really that simple.
Look, the most crucial point here is that you just shouldn't guess when it comes to your health. It's not a game. When you see those red flags we talked about, trying to be a hero and toughing it out is a really risky bet. The smartest, fastest, and safest way to get better
is to get professional help, period. So that leaves us with one final question for you. We can't stop ourselves from ever getting sick, that's just life, but we can be prepared. You now know the signs to look for. So what's one small thing you can do right now to be ready? Maybe it's putting your doctor's number in your contacts, or looking up the closest urgent care. Because being prepared is how you take back control, even when you're feeling your absolute worst. Thanks so much for joining me.